Thanks very much, Bob. And I'd like to expand on the fact that I have many mentors here and appreciate the opportunity to celebrate that part as well. I remember many lunches of the Swine group on Fridays where we discussed various aspects of swine medicine, snail farming, or whatever else came up. And part of the challenge that Mike always gave to us was there really wasn't a dumb idea. We needed to bring them out, and some of them would come through, and some of them we'd bury correctly. And Kate's been involved, and Bob, and others of you. Case DeLang came to some. Of course, Bob Huntsberger showed up, and I can't remember all the dumb ideas, but as graduate students, as faculty, I think part of the challenge is to expand ourselves and to always ask, what's next? What are the opportunities that we have in place within the swine industry, serving the swine industry, and also looking forward? And so I'm going to take you through some of those thoughts. Not all of them are right, and you have to sort through them. But hopefully we'll expand upon the idea and the opportunities for us to work in this area. To explain the title a bit more, the central thesis is actually something that I've been mulling over for about the last 30 years, and it's from Glenn Fox here in is it agriculture economics yet? They keep on changing names for economics for arguments of relevancy. But in microeconomics, his argument was that macroeconomics, the behavior and the economics of the industry as a whole, is actually a function of the activity of individuals. And we've worked off of this assumption for a long time, that we need to get better as individual farms, as individual enterprises, as veterinarians, nutritionists, geneticists, and the like. But I think we're hitting our limit on microeconomics, that somehow we need to get together better and address some of the large questions that are in front of animal agriculture in many societies. This is driven by a few factors. As Bob mentioned, I've been involved in something called the One Health Workforce Project, trying to develop capacity and workforces in areas where there's emerging pandemic threats, especially in Central Africa and Southeast Asia. And we need a recognition that we have a common biome, that we have pathogens, that we have an industry, that we've got feedstuffs that need to integrate, and we need to manage what we have in place. And we can screw up badly in those areas, and I've seen too many examples over the last number of years. I also want to emphasize that we have a common demand. One of the things that I did in pig production, I didn't disappear totally, was to emphasize and analyze what is happening in the futures market for pig production. And I was on the supply side, figuring out how much supply would show up in North America. And it got pretty simple. There were some hiccups, some differences, but we're doing an extraordinary job in increasing the productivity of swine farms. And it's not only in pigs per sow per year or average daily gain, but it's also in the way we use our enterprises, the pigs per sow space per year, the pounds per square meter of floor space, the utilization of capital. And those efficiencies are going up quickly and scarily. And we're not getting control on the demand side. And I'm going to discuss in part on that aspect, is we need to move beyond that efficiency, those efficiency numbers that we normally attribute to swine farms, and start asking, can we do more for the overall positioning of the swine industry? And frankly, if we take a look at the types of grants, the type of competitions that we have as academics, we're seeing more and more emphasis and expectation on us in academia to drive some of those changes, and yet I don't think we have a true model of their effects. The future of higher education then is trying to fit into that future. I've come back off of the road working with the One Health Workforce Project, and the first thing that my department chair and my dean gave to me was search committees. And we've accumulated 6 to 8 positions that are associated with swine production, and we have to fill them. And the question is not only how do we fill them and who do we fill them with, but what are they going to be doing 20 years from now? What are you going to be doing as graduate students 20 years from now? And how are you going to justify your existence? And it's going to be different than when I was hired 20, 30 years ago into this industry. And I'll try and model some of that forward. The other aspect that I want to bring together as an example is a word called co-opetition. It's an amalgamation of cooperation and competition. And I want to use as an example a project of a colleague of mine who suddenly passed away 2 weeks ago, Dr. Bob Morrison at University of Minnesota. And he has been attempting to work with producers sharing disease data, actually has more than 50% of the sows in the United States in his data set, looking at those dynamics. And how do we not only cooperate to create that, but also have a competition that is so much part of the swine industry to keep moving forward? So that's the summary. Here's a few examples of some of the objectives that we can look at. And the scary part of this is I wrote this slide approximately 25 years ago, and I'm still trying to get through it. When I graduated in 1984 with a couple other people here in the room, we talked about herd health. That the assumption was if a herd is healthy, it's going to make you money. And we disproved that. We took it overboard and spent too much money on certain health mechanisms and realized that underneath health, there was a layer of productivity. That not only did the animal need to be healthy, it needed to be productive. It needed to create pigs per sow and the like. And much of that expansion occurred with the increase in record-keeping programs such as PigChamp, started to illustrate the great diversity of productivity in our industry, and it became a focus. We realized productivity wasn't an endpoint either, and we looked at and compared the profit and loss statements between farms of different levels of productivity and didn't always see a correlation. And so there was an emphasis in reducing costs. And again, we in the industry did a very good job at that. I always explain that not only I grew up in Drayton, but you probably recognize I'm either Mennonite or Dutch, and I'm of the latter, and we refined the skill of cost minimization to a great deal. And so that was an easy part. Over the last 15, I'd argue 20 years, we've been arguing profit maximization. There's an assumption that when you minimize costs, you maximize profit, which again isn't true in the long run if you overemphasize cost minimization. And we're working through some of those aspects of trying to increase the value of the product, using opportunity costs, using other approaches in what we call management accounting rather than financial accounting to identify and maximize profit maximizing steps. And we're getting through that area. And frankly, in many ways, that's our current level of evaluation of technologies. And we have a challenge there then all of a sudden as well, that back in 1958, there was a concept created called the technology treadmill, that if we get good enough at this, we're going to force enough farmers out of business, and we're going to create an industry that is not going to be profitable because it's always going to be dependent on increasing the technologies and competing on a technological basis to differentiate the market. And that's kind of where we're at. It's kind of scary in some ways. I did a review for a group called International Finance Corporation a couple of years ago, comparing different industries and taking a look at the threats. And the argument is that, sure, you're productive, but what's your demand? And the predictors of profitability are more and more on the demand side to create that profitability. And it's not only based on overall demand, but also on the insults that can occur to our industry. And coming back to the common biome is how many parts of our industry actually have a plan for if or when we have a disease hit our industry that shuts down exports. In the US, it's now about 24% of production. It's higher in Canada. I haven't been following the number. We do not have a market. We do not have a case. And it's a huge risk that you can calculate as actually having a net present value and a true cost for each pig produced in the area of $3-4. And what are we doing about that? And that, to me, is a major question as I toured around and took a look at different diseases. How do we make a robust industry, an industry that has the demand under various circumstances? Here's another real old graph that actually took from a colleague of mine, and it's my basic economics argument for my veterinary students. We compare costs and benefits of a decision, whether it's to share disease data, whether it's to invest in marketing, whether it's to buy a vaccine. Of course, there's the really dumb ideas, and the ones that Mike would shoot down really quickly, that there's alternatives that are less effective and more costly. And again, coming back on my heritage, we got rid of those really quickly. There's also, on the C side, there's alternatives that are more effective and less costly. That's called a win-win. You're still reducing your costs and you're actually getting better results. Not very difficult either. Then there's the third quadrant, the D, which is they're cheaper but less effective. And so that's where we get into cost-benefit ratios and comparing the pluses and minuses under different circumstances. And then finally, we have the alternatives that are more costly but can be more effective or are more effective. And again, the analysis has to be in place. Right now in the industry, we're really emphasizing that D quadrant, that by creating something cheaper, we hope that the effectiveness still comes up. Early in my time in North Carolina, we had this huge argument about erysipelas vaccine. Needed to buy about 2 million doses at a time. And they found a supplier that would provide erysipelas vaccine at a 20% discount, and the owners wanted to switch to it. Easy enough decision on that part, except we as veterinarians had heard through the grapevine that it wasn't as effective. There was going to be, we expected more outbreaks associated with it. So the first question is, are the outbreaks important? And we said, well, we're not sure. And then someone had the bright idea to actually test the vaccine and see how much antigen was in there. And we actually showed that the new vaccine had half the level of antigen in as the old vaccine. And so here was the quiz question for the veterinary students. What did the owners decide to do based on that information? Use a half dose of the original vaccine and save even more. And so there are many of those kind of examples. The problem with cost versus benefit is the costs are easier to identify, that you pay for it, you have a bill. The benefits often show later on and in various methods. And especially up in the B quadrant, we have this challenge, especially in managing risks, when I say a disease may enter your herd or we need to work together on investing in our future. The question is, how does that benefit show up? How do I gain that? I know I have to pay these bills to gain that part, but actually identifying those two levels is going to take very different accounting and approaches. And not all of us have been trained in that area. I want to give the other example from medicine of a challenge, and I'm going to go a bit into that as far as the discipline goes. And it was a simple question of, does individual health, if we try to maximize the individual health, do we actually maximize the health of the population, of the aggregate? And I give as an example, what's the best vaccination policy for an individual? And another story, I get invited to League of Women Voters, which is sort of a left-leaning group in the United States that discusses various issues, and they wanted to discuss vaccination, and someone had the bright idea of bringing in a veterinarian and actually trying to describe this sticker, which we give to all the students at University of Minnesota when they get vaccinated, which says, "I did it for the herd." It's a free walk-in flu clinic, which argues, and rightly so, the real value of vaccination is for the population, for the herd immunity. Hopefully all of you understand that, and not for the individual. And League of Women Voters asked, well, is this true? And I said, yes. And they said, well, is there any better strategy? And I said, there is one for many diseases, and that is to persuade everyone around you to get vaccinated and don't get vaccinated yourself. And I offered to do a lottery for them to decide who is that one person in the room that doesn't need to get vaccinated. And there's game theory. There's questions, how do we approach things as a community to gain the greatest benefit for that community while not ignoring individual aspects? We have the challenge of distribution of resources between farms, between individuals and the like, that we worked in some of the poorest countries in both Central Africa and Southeast Asia. And we recognize that the burden of disease, especially infectious diseases, in this case malaria, is very much a focus of countries with less resources. And how do we allocate those resources as efficiently as possible for the aggregate? And so an example that I hit early on was in DRC, Democratic Republic of Congo, where I suddenly realized as I started going through the economics of disease control that the GDP on average in DRC was less than the amount it took to keep a pig fed and housed in Minnesota. And so we had a different level of resource allocation, and we knew that we had to emphasize public health. And the last thing that I could bring in was doctors and MDs who wanted to cure everyone one by one. And we have that decision time after time that we have to do public health instead of individual medicine. Now, what's the corollary in what we do in the swine industry? Well, we don't do medicine or treatment one by one, but we do have individuals, and we have an individualistic approach on farm by farm, owner by owner, enterprise by enterprise. And we don't have a discipline or a way of explaining and focusing on the industry as a whole under many circumstances. And it's hard to make veterinarians and others who get paid by the individual to take on a strategy that takes on the whole industry. And that's a concern to me for a number of reasons. Remember, I'm trying to hire people. We're also asking, what is the veterinarian of tomorrow? What skills do we take into the veterinary school to create capacity that transfers to the veterinary students that frankly makes them more marketable? And we need to get beyond individual farm health to industry health and figure out a revenue stream associated with that. And probably you all recognize that public health is the poor brother of individualized medicine. Public health does not get the glory of a surgeon. And in reality, there's many more benefits. Just another side issue, we went into DRC simply because of some of the concerns about Ebola. This was from Kikwit in about 600 miles from the capital of DRC. They had an outbreak, which their answer was to shut down the hospital, and they actually chained it shut to contain the outbreak. Makes sense on a public health basis, but when we took that in front of our medical students, it was a hard thing to create as an example of some of the decisions they could do. And we do the same thing comparing human lives and animal lives as well. In One Health, we're concerned about a number of different zoonotic diseases, and one of the concerns time and time again is if you have a disease in chickens that could affect humans, do you kill all the chickens? And that's been a common answer. And the question is, what is that balance between humans and chickens as far as a concern? And frankly, some of us have tried to do reductionist approaches. Here was a report from Norwood and Lusk that did a survey that estimated the equivalency is about 11,000 farm animals can suffer if the suffering of one human could be eliminated. And frankly, it was chickens, not pigs, so not sure what the ratio is on that basis. And of course, the question is, and we have to address that time and time again, is that a true equivalency? And again, asking students and others, if you have a burning barn and you have the choice of saving a baby in a baby buggy or saving 11,500 chickens, when would society give you credit for saving the chickens rather than the baby in the baby buggy? We don't have that equivalency in economics, and there is a primacy of decisions. I want to give you another example, and this is one we discussed some time ago as far as a challenge in creating individualistic decisions versus otherwise. First of all, and this is, how many have watched Dr. Strangelove? I always do that. Yeah, it's getting less and less. It's not a good lesson anymore. I've tried to do hip extracts from lyrics from songs and readily recognize that all of a sudden I'm doing something that's 20 years old. But Dr. Strangelove was a movie that concerned bombing or nuclear war falling out, and it was a comedy recommended at some point. But I changed it to how I learned to love PEDV. And my argument is, on an individual basis, PEDV was devastating. On an aggregate basis, it had a lot of benefits. It got rid of pigs at an opportune time when they hadn't eaten any feed and got them out of the market when we had an excess of pigs, raised the price, and there was a net benefit. And I would argue that PEDV taught the industry how to do a much better job on biosecurity and actually save the industry from increased levels of other diseases and possibly inhibited the entry of foreign diseases as well, whether it be African swine fever or FMD or the otherwise. And it's just an example of an aggregate benefit that isn't being recognized or not It's hard to celebrate a disease, but nonetheless, no one was talking about the great things that PDV actually did, except for me, and that didn't go very far. And so that's me on the back of a bomb, if you remember Slim Pickens at the end of the movie, celebrating some odd things, and I'm going to take you a bit deeper into this. One other example that concerns me is over the last year is that we've worked off of other white meat, lean deposition, loins, and look what's happening to our loin price versus our belly price. And actually, we've got times when the pork butt, which for you who are new to cuts of meat is not from the butt, but from the shoulder, which is always sort of confusing as well in terminology, exceeds the price of the loin. And we haven't done much marketing on that at all. It happened in spite of us as an industry, and frankly saved our butts during this past winter. And really, one of the big challenges that we're discussing right now is on demand side, and something to think about is whether or not we're going to follow what we call the nutritionistas, that we are what we eat, or in fact, we eat what we are. That culturally, pork is part of many societies, and there is a celebratory aspect that goes well beyond a nutritional aspect in many cases. And we're actually spending some more time with food anthropologists and less time with actual understanding of the nutritional aspects of pork. And how do we explain and develop that demand? And we got to work on that part. Some of you may recognize that demand is quite impressive in some cases. Here's a type of Iberico Hamon that sells for about 4,100 euros per leg in southern Spain. Tremendous opportunities. Controlling that market, keeping it from being flooded is a major challenge, but Eduardo does okay. If you take it to an extreme, and again, it's a lesson, if you want to eat local, if you want to minimize your carbon footprint, if you want to have a diet that's been tested on many individuals, I would recommend that you get a feed bin. Take some corn, local corn and soybean, sprinkle on some vitamins and minerals, and eat that. Not only would it be healthy, but it'd be tremendously cheap. You wouldn't need a kitchen, you wouldn't need freezers, you wouldn't need supermarkets, restaurants, and the like, and you'd get rid of about 25% of your expendables, especially at certain levels of income. Why don't we do it? Again, it's demand for something that creates a social good and has benefit, and we all need to explain that. Another challenge we have in Minnesota, and I think you have here as well, is also explaining animal agriculture. Minnesota consists of a northern part that, except for along the Red River Valley, is rocks and trees, similar to Ontario. We've got an urban center, and then we've got the plains, which is filled with corn and soy that is designed to feed monogastrics and ethanol production. How do we explain that the major effect upon the landscape of Minnesota is actually there for animal agriculture? And it's rarely recognized, but that discussion is coming into play. And is that enough of a change to the landscape, or a satisfactory change to the landscape, to feed our social good of eating pork and chicken in most cases in Minnesota, or exporting it? So we have a number of aims or constraints in pig production. We can look at welfare, and I've spent a great deal of time trying to explain welfare constraints. Worker health is a concern. Return on equity is a concern. Cost of gain, sorry, I repeated return on equity. Risk minimization. community viability beyond the workers to the community, environmental stability. As I've explained many times, is that I worry that the industry is actually treating many of these concerns as constraints. That you can decide to maximize something and interpret everything in terms of cost of gain or return on equity, but then you treat everything else like a stricture, and you're asking for society to create that stricture. I explain it in terms of my eldest son. I sat him down when he was young because he was teasing his sister, and I started explaining the different considerations that he should take into play about his sister, about what is civil and the like, and he finally said, "Why don't you just spank me?" And many producers have the same answer about welfare, about safety for individuals, for the overall good of the industry. Just tell me what to do, I'll do it, leave me alone. Has something to do with we're not all extroverts, or not many of us are extroverts either, but that discourse has to happen. And it's going to be complicated. There's going to be complexity involved. There's a real, for lack of better words, conservatism or reliance on historic norms in pig production, or in animal agriculture, or agriculture in general. There's stories, there's good histories involved in many cases. We divide responsibility, saying you're an expert in welfare, you're an expert in nutrition, and you work on your individual areas and we'll meld it together somehow. There's a bias towards standardization. Back in the 80s, the joke was most of the experiments were actually done by farmers, and we saw the remnants out behind the barn. And we're seeing less and less experimentation done on farms. And we're seeing less innovation occurring. And we're seeing more of an emphasis on reductionist approaches, of doing bit by bit the way we do science without integrating it into an overall strategy. I'd argue there's a lot of math illiteracy out there, and frankly, especially in veterinary medicine. I hear some nods as far as that goes. One of my first tests is give me the derivative of x squared, first order derivative of x squared. I get about 10-15% of the students actually remembering their calculus. And see some shaking your heads too, scary part. Frankly, it's more a test than anything else. There's an assumption of normality, and many of you have heard my sermon on that understanding how there's a distribution, how there's variation, how we create tail enders and involvement really creates a problem in the way we analyze. There's media politics that makes overgeneralizations about any aspect of what we do, and there's an underestimation of the amount of risk and magnitude of risk involved in pig production. I'm going to end with a challenge. I don't have all the answers, but think about these things as you think about complexity, and grab complexity. We can be complex passive, just say, bring it on, just spank me when it happens. And we're just going to rely on the environment, the government, and the like. We can adapt our behavior and try to survive, but often it's reactive against new situations, and we get together at that part. We can start looking at self-renewable systems that there is collapse, but we have it within the system to actually survive. It sounds odd. Right now, last week I was at a meeting talking about business survival in the face of FMD. And I was going, business survival in the face of FMD? All the farmers were worried, could they get their pigs to market? And I said, but there is no market. And And that was an acceptable answer. That the right answer was, if you can kill them on the farm and get rid of them, that's the greatest benefit to the industry and to society. And yet we don't have that imagination. And really, we have to evolve with different situations and understand and have people involved in business strategies to take occasions such as the introduction of FMD into account. Swine industry is complex. It's dynamic. It adapts a little bit, but it is chaotic as well. And the challenge to each of us in the room is to start taking a look at concepts such as coopetition. Sometimes the best way to stay competitive is not to compete, not to think and get ahead of the person beside you, but to ask how we can work together. And it may be less risky than you think. It may be the riskiest thing is to run as fast as you can, to try drive the industry. And there's various examples of competitive, cooperative, that are in the literature. And I wanted to give the example of Bob Morrison's work, and that we're trying to continue. And his question was all the time, are you willing to share your data, your premise ID, the aspects of productivity and transport for the benefit of the industry? And they asked, how is it going to help myself? And the answer was, well, maybe it won't. It'll help the industry. Hiding may be the best answer during early times of FMD, though it's hard to hide a pig farm. But asking time and time again and challenging the group to benefit the whole industry, and the only way to do that is by holding hands, is important. And he took this of emphasizing team learning, taking groups together and freely think about what's going on, like a Friday afternoon back in Guelph. There's time for sharing a vision across not only us in the technocracy that service the swine industry, but among the owners and participants as well. We need to have mental models that go well beyond, as John Patience said, simply a p equals 0.05 example, asking what can happen. There are untestable hypotheses that we have to take into account in pig production. We need to work on a personal mastery of not only developing a vision and understanding what happens in pig production, but, and they use the word spiritual inner drive, to pursue that mastery. I would add as well to communicate it. I mentioned 2 courses that I took during graduate studies that really benefited me beyond the epidemiology that Kate and I took and others. I took a course called Think on Your Feet, which was how to plan a talk and how to communicate some of the basics of the messages that you were trying to create and not go over time, which I am a little bit. And second of all, and this one is always harder to explain, I took Marxist economics, which actually is coming back into this and arguing how do we work as a group. And I've started saying that in the United States as well. It doesn't work too bad in Minnesota, but explaining that I prefer Marxist economics in North Carolina has been somewhat offsetting. And finally, the 5th discipline is systems thinking. Thinking about the whole system, bringing in different parts and understanding what drives each aspect. And sometimes we get a bit into the weeds in our research and understanding, and bringing together large groups such as this can be of great benefit. How do we improve in what we're doing? And I just want to emphasize we need the appropriate skills. We need to report them. We need an organizational strategy. We need managerial accounting versus financial accounting. We need estimates of risk and impact of various occasions and changes within the industry. If we identify those, we can start reducing risk. And we got to publish on that basis to make sure that it's a benefit to the whole industry. If you want to read something, this is from 1987, and it says Closing of the American Mind, and it's particularly appropriate politically at this point. But nonetheless, it's a critique on academia, and it's a question on academia. How do we involve different aspects? How do we become liberal in our education? And liberal means wide-ranging and understanding, and it was some of the aspects that I learned at University of Guelph, and I really appreciate it. But we need to be worried, and we need to hire the right people, engage the right people, and we'll continue to do it. And so here's a dolly of time gone by, and I thank you very much.